Still, good morning to everybody. Thank you, Amali, for those kind words of introduction. Today I'll be talking about very important group of devices that we use day-to-day practice. I know that we have a varied crowd today, starting from medical students to consultants. So I'll try to concentrate more on the practical aspect of use and with some little bit of scientific background to what I say. So for the next 20 minutes, probably I'll be talking about dry powder inhalers, the MDIs and spacer devices and nebulizers. So we all know inhalers and nebulizers are devices which are quite effective in delivering drugs to the lungs. And in relation to the respiratory system and its pathologies, we know it's bronchodilators and steroids, along with some antibiotics, are the main drugs that we make use of in the use of inhalers. And it has been shown that MDIs are the most convenient and cost-effective way to administer aerosolized medication to the lungs. And MDIs have been in use for the last 70 decades. So we all might feel that we know in and out of these devices. But the ground reality is different, where the studies have shown that up to 94% of patients do not use inhalers correctly. And it also has shown that 25% of the patients never received verbal inhaler technique instructions. And even those who have been given, the quality and duration is not adequate. So the point I want to make out is that all of us should have something to improve, and there's room for improvement in all of us. And when it comes to inhalers, the type of inhalers, we all know there are two main types. There is dry powder inhalers and the pressurized meter dose inhalers. First, I'll talk about some of the aspects for the dry powder inhalers. Now, you can see there are so many different types. Out of them, there are classified into three main types. That is unit dose devices, where you have mostly in the government hospitals the capsule form, where you have to load the capsule before you actuate it. Then you have this multiple unit devices like the discus, where it contains a series of blisters of capsules. We have to again load before you start the inhalation. And the third one is like the turbohaler, where they are reservoir devices, where the powder has to be again loaded from a storage unit. Okay, so should I use a dry powder inhaler on my patient, or is it okay to use? Now, to use a dry powder inhaler, you need to generate an inspiratory flow rate to aerosolize medication and to deliver it to the distal airways. Obviously, this will depend on the age of the child, so that smaller children might not be able to use it properly. Some of the devices will work on lower inspiratory flow rates, like the discus, but turbohalers, which are very good in delivery of the medication to distal airways, might need a bit of higher flow rate. So you might have to decide on the device as well when you decide on the dry powder inhaler. And the children who have persistent symptoms of asthma might not be able to generate sufficient amount of inspiratory flow rate, so that they might not be able to use it. Practically, what you can do is you can use a paper tissue and keep it let the child keep it in place in the mouth by forceful inspiration, and see whether you can keep it for 5 seconds without holding it. If you can do it, probably the child can use a dry powder inhaler. So just to recap, I'm sure you all know, but see whether you have anything to add on to what you already do. So as I said earlier, there are different types of dry powder inhalers. So the manufacturer advice has been read to how to load the medication. So you can use it with the standing up or seated up position. It's straight back, and you start with your breathe out completely normally, and keep the mouthpiece in the mouth, close the lips tightly around it, and you're breathing forcefully. Then you take out the dry powder inhaler out of your mouth, hold the breath for 5 to 10 seconds, then exhale slowly. Now, if you're using a capsule form, you can check to see whether you are completely emptied it. Right? And if you're not, you can inhale again for about keep holding for about 5 seconds. Next, we'll move on to the more popular form of inhaler among most of the clinicians. That is the pressurized meter dose inhalers. Now, it is preferred due to so many reasons, because it has some advantages over dry powder inhalers, such as it has a convenient multi-dosing. You can use it without loading it again and again. And also, it has been shown that it has lesser variability of drug delivery among patients. So whether you are a small person or a patient or a bigger child, so the variability is less. And also, because it doesn't need that much of a peak inspiratory flow, you may use it better in poorly controlled asthmatics. But of course, it has its disadvantage where you need a better coordination of the actuation of the device and the inspiration. So earlier there was so much of talk about the CFC, which is not no longer in use as a propellant. Now we have the HFA, which is considered more environment friendly, and also it has better delivery of the medication to lower airways than CFC. And MDI, especially in children, it's better to be used with a spacer. Now, when you use a MDI, there are some practical aspects we all, some of us will know. If you're using the inhaler for the first time, or have not used for some time, or dropped the MDI, then you need to prime it by discharging up to 2 to 4 puffs. And you have to make sure you shake the inhaler well to mix the propellant with the medication before you use. So whether you're using with a spacer or without a spacer, you have to think about this. As I said, it can be better to be used with a spacer, and we all know spacer is an open-ended tube which allows the aerosol to expand and the propeller to evaporate now. And also the large particles which will not travel to the distal airways. As you know, the smallest size particles, 5 mics, the other one will be traveling towards your distal airways. So the large particles is left to settle on the wall, and it has been shown that it improves the sending the medication to distal airways. And the most important thing about spacer in children is it eliminates the need for coordination of the actuation and the inspiration. So that's why it's better to be used in children. Now, in a practical sense, you will be bombarded with so many different types of spacer devices. Now, how to select a spacer? Now, on the left-hand corner, you see a spacer without a valve, and all the others are different types of spacers. You can see some of them have a face mask and others are not, and they have different sizes and shapes. Obviously, when it comes to a smaller child who cannot selectively breathe through the mouth, they will need a spacer with a face mask, and you have again different sizes of face masks. So make sure that it covers the nose and the mouth in order to make a seal. And when it comes to the selection of the spacer. Otherwise, again, there are different sizes, shapes, and some are valves or some are without valves. Now, a standard spacer should have a valve. Now, several years ago, where the spacer devices are not much available, we used to make a spacer using all these drinking bottles. Hopefully, we don't have to go back to that era. Hopefully, in the future, and the standard spacer should have a volume of 100 to 700 in volume, and the distance from the nozzle, the mouth should be 10 to 13 centimeters. So these are the standard spacer. Now, when you select a spacer, think whether about these factors when you select. Large volume spacers need longer time to empty. So this might be a fact to consider because some children do not have the patience to inhale for 30 seconds. And also there are some spacers which might need higher inspiratory flow to open up the valve, so which might be an important fact, especially in small children. When you use a spacer, you have to think about this priming. Now, most of the spacers that are available are made of plastic material. So they have electrostatic charges that attracts the drug to the wall. So to minimize it, either you can use a electrostatic, non-electrostatic metal spacers which are available earlier, but nowadays not commonly available, maybe on limited scale. But the thing that we can do is washing with a dilute dishwater detergent, and also not washing off afterwards. So then letting to dry. So this way you can prime it. So you also can prime by using 10 to 15 doses of MDI, but given the high cost of MDIs, so this is not a very good choice in our setup. And priming is very important because it has been shown it improves the drug delivery fourfold. Then when you use a spacer with a face mask, now these are generally smaller devices, mainly used for smaller children. You have relatively larger volume ones up to 260 ml, and small ones up to 140 ml. And usually the small ones, now when you use a space with a face mask, you generally use with tidal breaths, because these small children are unable to have speed breaths. Then usually about 2 tidal breaths are sufficient to deliver the drugs. But the recommendation is going up to 5 to 6 tidal breaths. So that will empty the space, the drugs in the space. And now going beyond that is not that helpful, because there will be no significant improvement in drug delivery. Now, how do you use a MDI without a spacer? Again, now that the MDI has to be held upright with the index finger, and again breathe out normally, and keep the mouthpiece between the teeth and close lips around it. Press down the canister, and it's very important that you breathe in deeply and slowly. This might take about 4 to 5 seconds. Take time slowly, right? And deep. And to prevent vigorous inspiration, some of the devices will have a alarm, inspiratory flow alarm, to prevent this. And then you hold as long as you can, that is at least for 5 to 10 seconds, and you may repeat taking breaths in. When you use a MDI with a spacer, you do the same thing almost. Yeah, you do the MDI but connect it to the spacer and hold it upright. Upright position is very important. Then you breathe out normally. Then do the same thing by keeping the spacer mouthpiece in the teeth and close it. Then again breathe in slowly. At the same time you press the one cough, actuating, okay? And taking about 4 to 6 seconds or maybe 5 seconds, taking slow breath in and hold the medicine lungs for 5 to 10 seconds. And if you feel that you are not taken a good breath in, or you were not able to hold 5 to 10 seconds, then you can do the same, hold for 5 seconds. The studies have shown that there are common errors in the technique. One of the common is a failure to exhale before exhalation, and also failure to breath hold sufficiently after inhalation, in addition to others. So think about these when you advise the patients when you use these spacer devices with them. Now, this fact about whether you know the canister is over has been brought by Prasad as well earlier. You can make use of dose counter, but the MDIs that is available in the government sectors, we don't have this dose counters, but two of the main companies have dose counters incorporated in the devices. But what we can do is keeping a record of the number of actuations that you are doing. Now, we have been using this letter canister float to see whether it's over is not recommended. Then the other question practically some people have is, okay, we should breathe out through the nose or the mouth. But if you're using a valveless chamber, then you have to breathe through the nose, or you have to remove the mouthpiece of the spacer to breathe out. In a valve chamber, it doesn't matter whether you are breathing through the mouth or the nose. Then the other question is, so cleaning the spacer. Now, we have heard earlier, when you wash with the spacer device, you are generating electrostatic charges, and you have to prime it before you use it. So that because of that, you don't have to clean the spacer very often. Most will recommend cleaning it once a month, unless it has really too much of muck. And again, it's very important that you prime it before you use it again. Okay, can I use a nebulizer instead of a MDI on my patients? Now, in a very small child who are too ill or too young to use a MDI, probably you may use a nebulizer. But in an acute setup, when you have patient presents with an acute exacerbation, MDI with a spacer is almost equal or maybe better than a nebulizer in relieving the symptoms. And also, MDI with a spacer will have lesser side effects like vomiting, tremors, and tachycardia that you see not uncommonly when you use a nebulizer. Can I use a nebulizer at home? Yes, but at with some risk, of course, with infection and allergens getting collected in the reservoir. So if you're using it, you have to please make sure that you clean the reservoirs regularly. And also to prevent infection, you have to clean and rinse and air dry with users. Now, this is another special device that is available in, not very commonly, but quite expensive device in our setup called autohaler. It's a MDI which can be used without a spacer device, which might be handy in the bigger children who do not want to use a spacer and don't want to use a MDI as well. Right. So, what is the future of inhalers? So, as in any other thing, it's a smart devices. Now, smart inhalers are quite commonly used in the developed parts of the world. So, hopefully, once we come out of the economic hardships, we might see more of these type to come. So, this has been shown to improve the adherence of the medication of the patients, and also we can keep a tag on the control of the patients as well as through this. So it's quite useful for the healthcare providers as well. So before wrapping up, some take-home messages. Inhalers are very effective but costly systems of drug delivery to the lungs. So very important, they're very costly. And though they are efficient devices, the efficiency is closely linked to its proper use. And there's clear evidence of poor use among all startup clinicians. dry powder inhalers and pressurized medium dose inhalers have their own advantages and disadvantages, which need to be considered in the choice of an inhaler for a patient. Priming of MDI and the spacer, the technique, they are very important aspects of its use. And proper advice to patients taking sufficient time and emphasizing and re-emphasizing definitely improves the effectiveness of this medication. So with that, I'll wrap up. Thank you very much, SLCP, and for listening.